the resting position is 0. And pretty much you almost always mobilize in this position anyways. And you're going to mobilize either medially, laterally, superiorly, inferiorly, or on diagonals. Okay? And you should do all of those to ensure that that kneecap's moving effectively. Okay? So on anybody's kneecap, you should be able to just move it around. Side to side, up and down. Okay? And then diagonals. Somebody who is restricted, oftentimes what you'll have to do is if I'm going to do a medial glide, I'll come underneath, I'll put my thenar eminence right on the lateral portion of that patella, and then I mobilize it medially. See that? To do laterally, which to be honest with you, unless it's very severely hypomobile, you're not going to do that a ton because that runs into some problems with just the mechanism of the kneecap and things like that. But I come on this side and mobilize the exact same way. To go superiorly, I find the apex of that patella. It's very important that you don't get on top of the patella and push down and up because you have the fat pad under there and you can impinge that, and that often comes with people who scar down easily. They get fat pad hypertrophy. Okay, so you want to get right at the apex and just mobilize in a superior direction. Okay, just like that. And then you'll get right up on top of that kneecap up here and mobilize in an inferior direction. Okay, now to do diagonals, I'll come right at the corner of her kneecap and I will go superior medially. And again, stabilize his leg so it doesn't kind of flop around on you. And come that way. Right? I can go inferior and medial. Immobilize them that way. And then I would just get on the other side and do the opposite. Okay? But this is good. Eventually you guys are going to try it. This is called the distraction cuff, okay? I have to say it's one of my most favorite kind of tools you can play with for the knee if you have to do joint mobilization, okay? It basically, obviously, attach it right above the ankle and secure it very tightly. I then put my foot through it, okay? And I can provide a tractioning force through my legs, okay? So it's a little less labor intensive for me, plus I can put a lot of force in. I'll show you what is the easiest position, which is at 90. Again, I got my hands free, so I can just distract. Okay?
Whole perspective here.
And I'm just pushing down with my foot. How's that feel? Doesn't feel that bad.
Distraction of the talus. To find the neck of the talus, you follow the malleoli straight across. And that's where you want to put your pinky. So one pinky is down, and the other fingers, actually I'll use my left one here. Do you mind? Okay. I intertwine my fingers like this. So as long as I've got that pinky right across the neck of the talus here, I'm in good shape. Our resting position is about 10 degrees of plantar flexions, which is basically kind of a relaxed position for him. I can brace with my foot, and I'm just distracting like that. Okay? So it's a hard, you feel it? Yeah. If he's got a limitation in dorsiflexion, what direction should I glide the talus?
The mortise is concave.
The mortise is concave, so we're dealing with convex moving on concave. So it's going to be the opposite. Exactly. So whereas his foot is going this way, I need to mobilize his talus that way. So if I want to increase the dorsiflexion, I need to do a dorsal glide. Okay? You could call it a posterior. What do you have written on your thing? Posterior glide? Okay, whatever, same thing. Either one is the same. And again, now you're using the web space of your hand, and I'm getting right over the talus, over the neck of the talus. Sorry about my back. Stabilize the distal tibia with your other hand, so you're getting pretty low. So my hands are fairly close together. And remember your kind of mobilizing technique, even for the wrist. It's very much like a wrist mobilization because I have my elbow straight, my hand, my mobilizing arm is straight, and my shoulder is right over my hand. And I'm just going to glide posteriorly, just like that. Okay, and you can't see a lot, and he doesn't have a ton of motion, so But that's what we're going to do to get our dorsiflexion.
Anterior.
Anterior. So I have two options here, right? I could either pull up like this, but I'm pulling, right? And I'm always stronger pushing than pulling. So what's my other option? Flip them over. So let's have you flip over. Okay, let's just get this leg kind of up. Bend your knee for me. Yep, just so it's out of the way. Same thing. Now again, I'm under the malleoli here, so come right under the malleoli. Don't get right on the calcaneus. Get kind of under the malleoli, as close to the tips of the malleoli as you can. And you're just gliding anterior. All right. You okay there, Jeff? No. Back a little bit more. To distract the calcaneus, this actually makes a really nice stretch too. I want to grab the calcaneus, and I'm just going to glide it inferiorly like this. Okay, so that's my calcaneal distraction. But what would be really nice is if I want to kind of add a little bit of a stretch to that. So if you're just doing purely a distraction, just grab the calcaneus, just cup it with your hand. You're grabbing it, and you're just kind of pulling straight inferiorly. But again, if you want to give it a nice stretch, you can combine a distraction with some dorsiflexion. Okay, and just getting. If I want to increase his inversion, what direction do I need to glide with the calcaneus? Laterally, right, laterally. So I have an option this way. Get this leg up and out of the way. Now, maybe I'll show it the other way. Flip over. I'll show it this way so you guys can see. Okay.
That would have been very
Oh man, some of them I'm like, oh my god, I need a makeover. All right, so you're going to grab the calcaneus. No, really, let's not even go there. Grab the calcaneus, and I'm just gliding straight down. Okay. You have to make sure that you're keeping the calcaneus vertical or kind of in line with the tibia when you do this. I'm not inverting it or everting it. I'm just gliding it straight down sideways like that. That's my lateral glide of the calcaneus, and I'm doing that to increase inversion. Okay? Now, if I want to do a medial glide, again, what could I do? I could pull up here, get my my elbow and forearm should be in line of the treatment plane, and I'm just gliding medially like this. Again, the hard part of the mobilization is to make sure that you are not inverting the calcaneus. So just keep it. It's as if you're making this line go straight over like that. That's your technique for that. You could do your lateral glide the same way. Okay, you could be over there doing your lateral glide like that as well. So either way, you could do it with the patient sidelining or